Hello, my name is Dr. Avinash and I'm a dentist at Bangkok Smile Malo Clinic. Today I will be talking to you about dental crowns. A dental crown is a custom-made cap that goes over your tooth to protect it and increase its cosmetic appearance. It can be used to restore a tooth's shape, size, and strength of the tooth. Dental crowns can be used for many reasons, including restoring a chipped or cracked tooth, protecting a weak tooth. It can be used to support a bridge or a dental implant, and it can also enhance the look of your teeth to give you a more beautiful smile. Crowns are made from various materials. Depending on which tooth that needs a crown, your dentist may suggest the right material that is suitable for you. A metal crown is strong and will typically not chip or break. However, it is not very aesthetic. On the other hand, porcelain crowns may chip or break, but they are very beautiful and they look like your natural teeth, which makes them an ideal choice for your front teeth. We also have porcelain fused to metal crowns. We have the strength of the metal inside and the beauty of the porcelain on the outside. So you get the best of both worlds. However, it is not as aesthetic as full porcelain crowns. On average, a dental crown can last anywhere between 5 to 15 years. It depends on the amount of wear and tear a crown is exposed to, your oral hygiene practices, and any mouth-related habits. You should avoid any habits such as fingernail biting, clenching or grinding your teeth, chewing on ice, and other habits such as these. Your crown will be made to match your teeth as closely as possible. A shape guide will be used to measure and match the shape, and therefore the crown will be fabricated according to that. During the first few days of insertion, because the crown can be made slightly different from your previous tooth shape, you may feel it is slightly different. However, once you get used to it, it should feel normal. Also, while biting, if you feel that it is high or needs adjustment, please see your dentist to adjust it accordingly. Preparing a tooth for a crown usually requires 2 visits. During your first visit, your dentist may require some radiographs to check the surrounding bone to make sure there is no decay or any infection. After that is cleared, a preparation of the tooth will be done and an impression will be placed. A temporary crown will be placed and the impression will be sent to the dental lab to fabricate your permanent crown. After maybe 1 to 2 weeks, you come back in for your second visit. The temporary crown will be removed and a permanent crown will be inserted in. No, you should not feel any pain because we use local anesthesia to numb the tooth before it is prepared, and therefore you should not feel anything. Your mouth may still be numb after a few hours until the anesthesia wears off. You should refrain from biting on your lips or biting on your cheek to prevent any injury. It is also recommended to avoid any hard or sticky foods until the crown cement is completely set. It is normal to feel a bit strange after the crown has been placed. However, you should get used to it in a few days. A temporary crown is just that. It is a temporary. It is not strong. You should avoid biting on any sticky foods, or you should try to chew on the other side. And also, when you do flossing, you should try to pull the floss out from the side. And this can help prolong the length of your temporary crown until the permanent one is inserted. Dental crowns do not require any special care. However, the tooth structure underneath requires care against decay and gum disease. It is important for you to brush and floss to prevent these issues. There are a few problems that can develop with a dental crown. Firstly, you can have some discomfort or sensitivity. The crown can chip or break off or fracture. The crown can be loose. It can also dislodge. You may have an allergic reaction or dark line on a crown tooth next to the gum line. Your newly crowned tooth can be prone to some sensitivity or discomfort. If it still has a nerve in it, you can still feel a bit of cold or heat sensitivity. Your dentist may recommend a toothpaste for sensitive teeth, and this should help with your symptoms. Crowns made out of porcelain can chip. If the chip is small, a repair can be made with composite resin material. However, if the chip is extensive, then a new crown might be considered. Sometimes the cement under a crown may be washed out. This causes the crown to become loose and also allows bacteria to seep into the tooth structure. Crowns that are loose should be replaced immediately. Sometimes crown can fall off. It is due to an improper fit of the crown, or a lack of cement, or a lack of tooth structure and surface area for the crown to bond to. If this happens, you should bring the crown and see your dentist immediately. Allergic reactions from dental crowns are very rare. However, this can happen. An allergic reaction to a dental crown is very rare. This can happen because the metal used to fabricate a crown is a mixture of different alloys and metals. If this happens, a porcelain crown is probably more suitable for you. Sometimes you can have a dark line on a crown tooth next to the gum line. This is normal in crowns that are porcelain fused to metal. The crown is okay. However, for cosmetic reasons, you can have it replaced for a full porcelain crown.